Did you know that the red blood cells circulating in our blood has a protein called hemoglobin, which contains iron? The function of these red blood cells is to carry oxygen from our lungs to the rest of our bodies, then take CO2, carbon dioxide, back to our lungs to be exhaled. So if you have low red blood cells or hemoglobin in your blood, then you have iron deficiency anemia. My name is Dr. Amir, and welcome back to my YouTube channel. Iron deficiency anemia is more common in females because of the iron loss from their heavy menstrual periods. Of course, any illness which can cause a blood loss from either the stomach, colon, or the urine can cause anemia as well. In general, iron deficiency anemia is rare in males because men don't lose blood like women. So if we find it, we should investigate the cause of the anemia. One of my patients was 45 years old. He was complaining of being tired. His hemoglobin was lower than his usual baseline. Further tests showed trace amount of blood in the stool. Later, colonoscopy confirmed the presence of a colon cancer, which was oozing blood slowly, causing anemia. Another cause for this anemia is when people don't eat much iron in their diet, or if they cannot absorb iron from the small intestine, like in patients after stomach surgery for weight loss, or patients with gluten sensitivity, so-called celiac disease. So what are the symptoms? Sometimes patients don't have any complaints if their anemia is mild and gradual. But if the anemia is severe, they often look pale and complain of being dizzy, weak, and tired, to a point they cannot do their usual exercises. One of my patients with anemia was having chronic headaches, palpitation, and getting short of breath. Another common complaint in anemia is the tendency to eat a lot of ice. The diagnosis of iron deficiency anemia is simple by doing a blood count. Normally, the red blood cells are low, and the hemoglobin is lower than normal, which is 14 grams in men or below 12 grams in females. Also, the iron level and the iron storage, which is called ferritin, are both low. The treatment is simple, but most importantly is to identify the cause of anemia and treat it, like a bleeding stomach ulcer or colon cancer. Most of the time, we treat anemia with iron pills. In severe cases, if there is no improvement from the iron pills, we can give iron in the vein or even blood transfusion. My final advice: first, if you have anemia, you should increase the foods which are high in iron, like meat, spinach, and lentils. Second, taking iron pills can cause some side effects, like constipation, dark stool, and upset stomach. Third, cow's milk is poor in iron, so parents should give their infants iron-fortified products to prevent anemia. Of course, breastfeeding is better. And finally, pregnant women should take iron supplements because their iron won't be enough for the mother and the baby. I hope you enjoyed my topic today. To stay up to date with my latest videos, you can subscribe to my YouTube channel. Until I see you again, I would like to wish you a happy, healthy life.